Now I invite Dr. Soumya PP, who is working as glaucoma consultant in Contrast Eye Hospital, Talasheri. She will be talking on Beyond Drops, the role of neuroprotection in glaucoma. Over to you, Dr. Soumya.
Thank you, Manju. By definition, as you all know, glaucoma is a progressive neuropathy characterized by retinal ganglion cell loss and the visual field defects. So, the current standard, IOP lowering is the only proven modifiable risk factor but fails in many cases to halt the progression. The need for neuroprotection targeting the IOP independent neurodegenerative mechanism offers a complementary pathway to preserve the vision. So, what is neuroprotection? It is about going beyond the lowering the intraocular pressure to directly protecting the retinal ganglion cells and the optic nerve from damage. Why neuroprotection matters? IOP is the only proven modifiable risk factor, but many patients still progress despite good IOP control. Glaucoma is increasingly seen in neurodegenerative diseases similar in mechanisms to Alzheimer's, Parkinsonism, etc. The neuroprotection aims to preserve RGCs, their axons, synapse, connections independent of the IOP. So, only when we understand the cause of the retina and the optic nerve degeneration, we can tackle it and get to stop it. What is the cause? The axonal loss, which causes the RGC cell death. We have to understand there is a window period by that time. Here comes the action of the neuroprotection. So, what is the mechanism of neurodegenerative in glaucoma? That is the mechanical stress from elevated IOP damaging the axons at the lamina cribrosa and the excitotoxicity, that is excessive glutamate, NMDA receptor overactivity, and which causes later apoptosis. And there may be any oxidative stress mechanism that damages the mitochondria and the axonal transport as well. There may be some neuroinflammation which activated the microglia releasing the toxic cytokines, and there may be loss of neurotrophic support also. So these are the mechanisms. So what are the neuroprotective strategies? We have to consider all this. That is NMDA receptor antagonists. Memantin shows a preclinical promise. I will come into it later. Antioxidants and mitochondrial protectants, neurotrophic factors, calcium channel blockers as well. The stem cells and the gene therapy approaches and the existing IOP lowering drugs, which is neuroprotective side effects, that is brimonidine, which shows to protect RGCs beyond the pressure control. Coming to the NMDA receptor antagonists, there are nanoparticles with topical delivery memantin. These studies have been going on, and a notable study developed memantin loaded PLGA PET nanoparticles and has been used as eye drops with good safety and tolerability. And the next one is the alpha adrenergic modulation of NMDA receptors, that is brimonidine. As I told you earlier, it was found to protect the RGCs by modulating the NMDA receptor activity, not just via the lowering the IOP. Coming to the DOG3 mediated NMDA receptor internalization. Researchers identified DOG3, a guanine exchange factor which binds the guanine N2B subunit to the NMDA receptor in retina and preserving the RGC's survival. Then comes to the classic and combined NMDA antagonist model as well. That is, study is going on in this. Coming to the next one, that is antioxidants in the glaucoma management. The aim of the antioxidants is to neutralize the ROCs, protect mitochondrial function and preserve the RGCs. Another method. Most common antioxidants, vitamin E, vitamin C, coenzyme Q10, which I have been using also, alpha lipoic acid, polyphenols and N-acetylcysteine as well. Then mitochondrial protection strategy. That is coenzyme Q10 improves ATP production, stabilizes mitochondrial membranes. Then creatinine supplements, mitochondrial targeting antioxidants. Then comes the gene therapy that is going on, studies are going on this, and the lifestyle factors, that is diet rich antioxidants, that is berry leaves, leafy vegetables, omega-3 fatty acids as well, and the regular aerobic exercise to enhance the mitochondrial biogenesis. The recent research highlights and the clinical trials show coenzyme Q10 as well as vitamin E eye drops provide visual field stability in open angle glaucoma, and mitochondrial Q demonstrated significant RGC survival benefits in animal models of optic nerve injury. These are the neurotrophic factors I have been talking about. BDNF, the CNTF, NGF, that is giant cell derived neurotrophic factors as well, fibroblast, growth, all these acts and helps in the neurodegeneration. There are direct neurotrophin delivery, there is gene therapy, small molecule receptor antagonist, stem cell based therapy, and there may be combination therapy of all this. The direct neurotrophin delivery, that is intravitreal injections of all these BDNF, CNTF or NGV is also going on, and the gene therapy, that is viral vector markers like AAV and lentivirus delivering all these factors, allowing sustained local production. And the small molecule TRK receptor antagonists which mimic neurotrophic action without protein instability issues, and cell-based delivery, and a combination mechanism of therapies, that is neurotrophin therapy along with the IOP lowering and along with the mitochondrial production. These are the recent research findings, that is 2023 to 25, that is CNTF implants encapsulated cell technology showed sustained RGC preservation in human trials, and AAV2 BDNF gene therapy as well, and the mimatidine, and a combination of BDNF and coenzyme Q10. There comes another factor, that is calcium channel blockers. The mechanism of action glaucoma is neuroprotection, vasodilatation as well as IOP effects. The neuroprotection, it prevents calcium overload in the RGCs, inhibits calcium mediated excitotoxicity causing excessive glutamate release, and reduces oxidative stress and mitochondrial damage. It causes vasodilatation, relaxation of the blood vessels, and IOP effects has been also seen. In the normal tension glaucoma patients may benefit most as vascular dysregulation plays a role in this case. Targets for the gene therapy in the glaucoma. Why do we have to use a gene therapy? It helps to reduce the IOP, neuroprotection, neuroregeneration and mitochondrial support. These are the other recent advances that I have been telling. So coming to the emerging innovation approaches, these Rho kinase inhibitors, exocytotomes, nanoparticles, gene and step therapies also have been helpful. The challenges in translation to the clinical practice. There is a mismatch in the preclinical vs clinical outcomes for all these studies, and the studies are still going on. Lack of strong level 1 evidences and delivery limitation and safety concerns are also there. So the future direction is a combination of IOP lowering drugs with targeted neuroprotective strategy tailored to the individual glaucoma mechanisms. Is a designing better clinical trials has to be done, and advancing targeted delivery system. Then that's nano carriers and even gene vectors for safe and sustained neuroprotection. Despite huge research efforts, no neuroprotection drug is yet FDA approved specifically for glaucoma. So my summary and take home point is that glaucoma is a multifactorial neurodegenerative disease requiring more than IOP management. Neuroprotection focuses on salvaging the RGCs via intervention independent of the pressure control. A broad range of agents from pharmacological and neurotrophic to nanotechnological and genetic has been used. Thank you.
Thank you, Dr. Soumya.